Good evening, ma'am.
Hi,
Hi,
Bhavna. How are you?
I'm good, ma'am. Thank you. How about you?
All good. So, did you all get a chance to do your mock test?
Yes, ma'am, I did, and I got 50 out of 37.
Okay, that's a good progress. One second. So, as I was saying, that's a good progress. Keep on practicing. Am I audible?
Yes, ma'am.
Okay. So, only we have joined yet. We can wait for 5 more minutes. Okay. Content ischemic attack. So, when we did yesterday's questions, did you all get a chance to like have some idea about stroke?
Uh, Sorry, ma'am.
I was saying that you all must have done your mock test. So did you all get a slight bit of idea about stroke?
Yes, ma'am.
Okay. I think enough have joined, right? So we'll just start the class. Today's, okay, I want to ask others also. Did you get the time to do mock test?
I did.
I'm sorry, ma'am. My name is Govin. Yeah,
Okay.
I didn't done that mock test. I don't have time today. Maybe tomorrow we'll complete
Okay,
that one.
you'll have around 4-5 days till we finish our next topic. So
Okay.
till our next mock test, right? So just complete it and try to do it because questions are more important than topics. I'm repeating
Sure,
the same
sure.
thing again and again. Okay.
Sure,
So
sure.
if
Thank
you
you.
are
Thank
not
you.
aware of the question format, you won't be able to crack the exam. You will be thorough with the theory, but the
Okay.
questions are on a practical basis, right? So it will be more on what is right as a nurse, because what they want at the end of the day is a safe nurse with clinical knowledge, right?
Sure, sure. Okay.
So
Thank you.
if you go through the questions, I'm talking to others also. So if you go through the questions, you will see that it is generally based on what you have to do as a clinical nurse, which will be for the which will be the epitome of safety for the patient, right? So practice the questions, and we'll start the topic today. We'll be starting with stroke. So stroke is also known as cerebral vascular accident. But before that, we'll do this transient ischemic attack, which is also known as tiny stroke. It has all the same symptoms of stroke, but it is self-resolving and it is temporary. Okay. Am I audible to everyone?
Yes, but some echo is reflecting, madam.
Yes, ma'am.
Okay. It's actually my tab. Let me do it.
What about now?
No, it's good, ma'am.
It's good? Yeah. So, what is transient ischemic attack? What do you understand by this? What is the meaning of transient? Any idea? Anyone can just tell me what is the meaning of transient? It's normal English. The answer lies within the topic itself, the heading itself. Transient means something very temporary, which is lasting for a short period of time. Okay? मेरा पेन नहीं चल रहा. Lasting for temporary period. Okay? Period. Then ischemic is? What is ischemia? What is ischemia?
Insufficient.
Yeah, insufficient oxygen, right? So, lack of O2. And attack means something happened suddenly. So, what does it mean? That these symptoms of stroke, they arrive suddenly, they arrive for a very short period of time, and they arrive because of lack of oxygen, but not complete lack of oxygen. There will not be complete lack of oxygen. Okay, only the blood vessels would be a little narrowed because of atherosclerosis or hyperlipidemia. These two are the main causes, or hypertension. Okay, but there will be some blood flow, so the patient will revive on its own and recover. Okay, so he must be thinking that it's temporary, or maybe I just fainted. He'll not take it seriously. But you should always advise a patient. A patient should always come to the hospital after these sort of events, because you never know what is happening happening in the brain. Okay, so we just start with.
Actually, ma'am, the whiteboard we all assess this. Like we also write something here. So can you like
Yeah, I just saw. You all are able to write it. So I have a PPT, so no worries. I think whiteboard isn't a good option. I'm just putting it aside.
Hello, good evening, ma'am.
Can't hear you, ma'am. We can't hear you.
Hello, good evening, ma'am.
We can't hear you, ma'am.
I'm Muslim from Pakistan. Are you hear me?
No.
Hello, good evening, ma'am.
Am I audible?
Oh, yeah.
Yes,
Okay. Previously, what I said, were you able to hear it?
No.
No.
Okay, I'll just repeat. Are you able to see the screen?
Yeah.
yes, ma'am.
Yes,
Yeah.
ma'am.
So we have discussed. Yeah. So we already discussed transient ischemic stroke. What is it? It is a tiny stroke. It happens for temporary period of time. It is self-resolving, and am I audible, right?
Yes, ma'am. Yes.
Okay. So it is self-resolving. It does not mean that the patient will die. Patient gets up and he thinks that he has fainted, and he generally what happens, they don't take it seriously, but it is an early sign of actual stroke, which is CVA. Okay. So this is one of the risk factor. So you can remember transient by tiny stroke, tiny transient. It is not a permanent damage to the brain. Okay. It only happens because the blood vessels are narrowed. There is no clot formation. It is just narrowed because of the plaque formation, which happens on the side of the walls, and which is due to arteriosclerosis. I'm sorry, I don't know what happened. Arteriosclerosis or hyperlipidemia. Okay. So the main stroke is known as cerebrovascular accident. Now, cerebrovascular accidents, have you people seen any patient of CVA in ICU? There is a different stroke unit. If you have worked in ICU, anyone wants to share any experience? No? See, I'm not able to see your names. So, see. Yeah. So, you people can answer also, no? You must have experienced it, right? Have you experienced it in ICU? Have you seen any patient of stroke in ICU?
Yes, ma'am.
Yes, ma'am.
Why are you not answering? So tell me, what did you see? What was the patient's condition? Have you seen written in
Paralysis.
any cases? Yeah,
Paralysis,
tell me.
ma'am.
Paralysis. Generally,
hypertension,
Hemiplegia,
paralysis,
hemiplegia,
hemiplegia,
yes, and hypertension and diabetes, right? Everything is written in the
yeah,
case sheet, in the diagnosis.
Reduce blood flow to the brain.
Ischemia is that only. So it is it must be a ischemic stroke if there is reduced blood flow in the brain, right?
Yes, ma'am.
So I'll just discuss this. So when the brain lacks complete oxygen, what happens is when the brain will lack complete oxygen, what will happen?
difficulty in gait,
Ischemia.
difficulty
Yes.
in
Those are the
difficulty in
symptoms.
speech.
Those are the symptoms. Those are the symptoms.
And
What will
brain,
happen in the
and
brain?
brain cells will start to die.
Brain
Right,
cells will
brain
start to
cells
die.
going to
Very
die.
good. They will, the brain cells or the particular part or the particular ventricle will not receive oxygen. It will start to decay or die. Okay. And this can cause permanent brain damage to that specific ventricle or the specific part of the brain, which can hinder to that. Every part of the brain has some functions, right? So that specific part of the brain is dead. So those functions, the patient will never be able to do that again.
Like sensory and
Okay.
motor functions are impaired, ma'am.
That we'll discuss further. So it is a medical emergency, first of all, and it can lead to patient's death if not treated properly and not like it's not, the time is not noted, and if there is any sort of delay, so the patient can die also. It's a permanent brain damage. Okay. Next is, so brain function and anatomy. This so you people have read. So tell me which are the two main arteries that supply blood to the brain?
Carotid artery,
And
cerebral artery.
वो तो brain में ही होता है. That is already in the brain. That is an extension. But which artery goes through the spinal cord? Vertebral artery. Okay. So carotid arteries and vertebral arteries supply blood to the brain. Like they have their further extensions, further branches, capillaries, and they provide to every specific part of the brain. So each area of brain has a specific function, as I told before. So we should just this once. Frontal lobe is, this will come in NCLEX, that this part of the brain has been damaged. So what are the symptoms the patient will have, or what are the what will he not have? What are the functions that will be hindered? Okay, these types of question comes in NCLEX. So frontal lobe. Let me just go through it once, and then you can raise your questions. Okay, frontal lobe is has the function of thinking, speaking, memory, and movement. Okay, parietal lobe is dedicated to language and touch. Occipital lobe is responsible for what? Our vision, our color perception. Cerebellum, we discussed yesterday only. It's important for balance, gait, coordination. Okay. Brainstem is important for our breathing, respiratory rate, temperature. All the pituitary and hypothalamus is also there. So these are the functions it is responsible for. Next is temporal lobe, which is important for temporal, hearing, learning, feeling. Okay. So you must have read this before also, or if not, I'll just provide you this PPT. It's important to learn the functions of every, by heart it. No, don't even learn it by heart it, because the questions will come and you will confuse yourself. Okay. So, okay, there is this left side of brain and there is this right side of brain. So they both have their own functions. The right side is known for creativity functions, and the left side is known for logical functions. Okay, so right side is responsible for the attention span, showing emotions, ability to solve everyday problems by making decisions and plans, reasoning, understanding jokes, reading in between the lines, conversation making, having daily conversations, making judgment calls, very minor judgment calls, that shall I take bath today or shall I not, something like that. Okay, then memory recall, then music and art awareness. As I said, creativity lies on the right side. Then it controls the left side of the body. That you all know now. If right side is affected, then left side of the body will get hemiplegia. Left side of paralysis will be there. If left side is affected, then right side of paralysis will be there. Have you seen it in ICU?
Yes, ma'am.
You must have, yeah, you must have seen the diagnosis like left-sided. Pardon? Okay, you can mute yourself. Was there any questions from someone?
Ma'am, you highlighted with the red mark, like reading. So is that important in the
Yeah,
slide?
you can. Yes, it's important. It's important. It comes in NCLEX that if left side is affected, no, it will not even come like that. And like it will come like the patient has left-sided ischemic stroke. So select all that apply. What are the functions he'll be able to do? Then there will be options, and you have to see that if left side is affected, the logical side is gone. So what functions will be affected? Speaking, writing, reading, math skills, analyzing info. Okay, planning, anything that needs logical thinking, that will be affected. And also, if right side is affected, then your left side ka vision, it will be very limited. So you won't be able to see the left side vision. And if left side is affected, you won't be able to see the right side vision. Okay.
And ma'am, do we get the PPT to make the notes, or like?
I'll send you this afterwards. Okay. All good? Yeah. So classification of CVA. First is ischemic stroke, second is hemorrhagic stroke. Okay. Now, in ischemic stroke, as I told you, the blood vessels have plaque. This is called plaque. Okay. This yellow wala. It's called plaque. This is formed because of what? This is formed because of, yes, atherosclerosis or hyperlipidemia. Okay. Yes. So they form and they narrow the blood vessels, and when the blood passes through, there is lack of oxygen. The oxygen-rich blood will not be able to pass, or will pass in a very minor amount. Yeah. But secondly, if there is any embolus formed in any part of the body, embolus can be formed in any part of the body due to any reason. So the main reason maybe is the atrial fibrillation or endocarditis, or when we put IV cannulas and the air embolism is done there. Air embolism doesn't matter that much, but yeah, endocarditis is one reason, and this thing, our atrial fibrillation or any flutter in the heart is there. The contraction of the heart, there will be more blood pulled towards the heart. So the risk of formation of a clot is more. So that can be one of the reasons. So if a clot is stuck in this region of the artery, what will happen? There will be a blockage for blood. So the region where blood is not reached will be deprived of blood. Okay.
Brain disorder.
Yeah. Brain disorder, we cannot say that, but yeah, this part of the brain which performs the specific functions, they will be depleted. Okay. And second is the hemorrhagic stroke. Hemorrhagic stroke is one caused due to aneurysm. Now, what is aneurysm? Simple terminology. What is aneurysm?
Rupture in the arteries.
Yes, rupture in the arteries. Now, in this, what is the main cause? Hypertension. Why hypertension? Everything will make sense now.
Low
Why
blood pressure.
hypertension?
Low blood pressure.
High blood pressure. High blood pressure. There is no low blood pressure in stroke. There is always a high blood
नहीं
pressure.
मैम
The
लो
blood
ब्लड
pressure.
प्रेशर ब्रेन को लो ब्लड प्रेशर जा रहा होता है.
No. ब्रेन को लो ब्लड जा रहा होता है, but
Right.
pressure, hypertension is there. Severe hypertension is there, but yeah, blood rich in oxygen, it is not able to reach a certain part of the brain. Or in hemorrhagic stroke, what is there? There is a leakage. So when there will be a leakage, there will be clot formation. First of all, there will be
Yes,
increase
ma'am.
in ICP.
It's leakage,
है ना?
aneurysm, intravenous malformation.
Yeah. So there are two types of hemorrhagic stroke also. Thrombotic and embolic, so you got it. Thrombotic is this, and embolic is there is an embolus formed and it is stuck in this. Okay, these are the two types. Hemorrhagic may one is intracerebral and second one is subarachnoid. So just let me you can just guess it by the name only. What can be intracerebral? Is this type of stroke which is shown in the picture, is it intracerebral or subarachnoid?
Intracerebral would be in the cerebrum.
Intracerebral.
Yes. And why? Because it is in the main parenchyma of the brain. It is in the main part of the brain. So it is intracellular. The second one is subarachnoid. So arachnoid must ring a bell to you, that arachnoid mater, dura mater, right?
Yes, ma'am.
Yeah.
These are the
So
layers.
any clot formation or any leakage or any aneurysm which occur in the base of the brain to the there is a gap between arachnoid mater and the base of the brain or the pia mater. Okay, so any hemorrhage occurring there will is known as subarachnoid mater. Is known as subarachnoid hemorrhagic stroke. Sorry, am I making sense? Is it clear? Any doubt?
No ma'am.
Understood now?
Yes ma'am.
So
Yes.
you can tell the causes by yourself only. So what can cause a intracerebral stroke, hemorrhagic stroke? What may be the reasons? First, I told you hypertension. Then what else is written in the case sheet when you see the case sheet of a stroke patient?
Stress,
Trauma.
smoking, history of smoking,
Smoking,
history of
yes.
stress,
Trauma.
Severe headache.
Bleeding
Severe
disorder.
headache is a signs and symptoms. They are signs and symptoms. I am talking about risk factor. Smoking is one.
and
Hypertension is one. Did
Trauma
anyone say
and
diabetes mellitus in the previously in the class? So that is one. How does
obesity.
diabetes mellitus? Obesity is one. How does diabetes mellitus affect the blood vessels? You have to
And
interconnect the dots.
and through the kidneys.
It will make the blood vessels rigid because the RBC formation is delayed. So the blood vessels are very rigid. So when if a patient is having both hypertension and diabetes, the blood will flow with acute pressure and it will rupture the artery. Okay. Shall I move forward? Any doubts? First is smoking. Smoking is self-inflammatory, self-destructive, sorry. So if you're smoking, you have a higher chance of stroke. Thinners are anticoagulant agents. So if the blood is thin, so if the patient is having hypertension and the blood is thin, so what will happen? Blood will flow with more speed, and it will and with time the blood vessels will get fragile and they have a higher chance of rupturing. Okay. Rhythms may, I told you, arterial fibrillation. You can write these actually. Rhythm may there is arterial fibrillation and arterial flutter. Okay. Oral contraceptives, especially for women. Oral contraceptives have a side effect of stroke. Skin, if it is genetic.
Arterial fibrillation
and arterial flutter.
मैडम हेड ट्रॉमा भी हो तो उसमें भी ये हेमोरेजिक स्ट्रोक हो सकता है.
Yes, of course. I have found this mnemonic for remembering it. So the mnemonic is strokes happen. So you can just see the first letter of every word. You can write like that. Strokes happen. Okay. So next is head injury is also there. But head injury will be caused, and what will happen? Aneurysm will happen, or there will be head injury and. Okay, nothing else is there. But yeah, when your head injury occurs, and if it is affecting the brain, the main reason will be aneurysm. So it's written in the end. Okay, you can also write head trauma after that if you wish to. Okay.
and previous TIA means
Previous TIAs, we studied in the beginning now. What is a TIA? Transient ischemic attack, which the patient will never take seriously, and he will think that he must have fainted. But it's a very clear sign of, upcoming stroke. Okay. So, family history. If there is a family history, you don't have a choice. Then you are at a risk of it. Excessive weight, there you have a choice to decrease your weight. Senior citizens, as a person ages, the chances increases because the diseases increases. As a person ages, he somehow gets hypertension and diabetes, so the risk increases. Okay. Atherosclerosis we have discussed. Physical inactivity. If there will be physical inactivity, a person will get obese, and this will also lead to that. Previous TIA, I have told. Elevated glucose, DM, if there will be diabetes mellitus, the blood vessels will start to deteriorate. So if the blood vessels will start to deteriorate, there will be more chance of rupture of the blood vessels. Okay. And aneurysm. Aneurysm is brain injury, head injury, trauma injury, which will cause aneurysm. So strokes happen. Can I change to the next page?
Yes, ma'am.
Okay. Is there any doubt till now? Was there any doubt with the classification?
No, ma'am.
You can just, no now?
No.
Or you can ask me about like after the class also, if there is any doubt.
Okay, ma'am.
So this the universal symptoms and like symptoms of stroke. So iska called be fast. Be fast is balance, eyes, face, arms and legs, speech and swallowing, time. Balance is in balance what you have to see.
ataxia.
Ataxia and vertigo. What is ataxia?
Involuntary movement.
No. What is ataxia? Disturbed gait, balance, no balance. Right? Uncoordination, disturbed gait. Yeah. Vertigo, dizziness, ringing in the ear. Must have read somewhere. Okay. So balance, these are the signs. Eyes में what you have to see if the patient is having blurry vision, diplopia, patient is seeing double,
Double
visual
vision.
field defect, patient is not able to coordinate where is what. Okay, face, in face you have to see if there is any sort of weakness at one side of the face, if there is a smile sort of expression on the face, drooping smile sort of expression, or there is numbness in one side of face and the patient is not able to express this to you, speech difficulties there. Arms and legs may you have to see extremity numbness or weakness at one side. It will generally be on the one side only. Then for arms and legs, there is a method called pronated drift, in which you tell the patient to raise their hands or just raise their hands like this. And if the patient is not able to raise the hand and he's dropping one hand, that is a clear sign. Okay. Then next is speech and swallowing. Speech and swallowing में you will see aphasia. What is aphasia?
I think inability to speak.
Okay. There will be no speech. That is that what you said?
Inability to speak.
Inability to speak. Okay. Right. Then dysarthria. The muscles will not be working, so the patient will not be able to speak. He wants to speak, but he won't be able to speak. Dysphagia.
Difficulty of swallowing.
Difficulty in swallowing. Then time. So if the patient fainted in front of you and you are the one who's watching, that this is the time then that the patient's symptoms have started, or you have not seen other symptoms, but you definitely have to see the time, that what is the time and why is that? Why is time so important in stroke?
In 1 hour, that's the golden time, and they need to get
Yes.
treatment.
Yes, absolutely right. In 1 hour, it is the golden time, but TPA, like you can administer TPA till 3 hours. Since the symptoms have occurred, you can administer it till 3 hours. Okay, but 1 hour is only left till the patient reaches the hospital. So yeah, we should also read this. I have already told you that if there is right brain injury, then left side of the body will be affected. Okay. So what are the findings you can see? Can't see things on left side. I told you now, left-sided vision will be impaired. Okay. If right side of the brain has injury, left side will have problems. Remember this. Okay. So left side neglect, ignores left side of the body. Okay, the patient will start neglecting his left side. Okay, and why is that? Because this is patient's right brain is patient's creativity side. It's not patient's logical thinking. So he won't be able to think logically. So he will do rubbish things as in he won't be able to think properly. That's all. So he will neglect his body of that side. He will have trouble maintaining proper grooming. He will have emotional distress, not going to think things very through. He will be very impulsive and he may be very agitated. These patients are more agitated than the other one. The other one are more into depression because they are thinking logically and they know what is happening around their body. But these patients will be very aggressive and very impulsive. Okay. So you have to remember the right side is for creativity. So impulsive. Left side, logical. Okay. So poor ability to make decisions and assessing spatial elements, shapes. Okay.
Ma'am, you please unmute your screen.
Am I audible?
Yes, ma'am.
So कहाँ तक सुना?
Ma'am, can you show the previous slide, ma'am, please?
Previous slide.
Okay. Okay.
Okay.
Emotionally, we have listened.
Yeah, all the emotions. It was related to. It was responsible for emotions, right? We read it earlier. Right
Yes.
side of the brain is responsible for emotions. So all the emotions will. He will be very impulsive because he won't be able to guess what is happening. He will be very agitated. Poor decision making. Why? Because I will provide you the PPT afterwards. You really don't have to write as such.
Okay, ma'am.
Okay. I'll provide you the PPT. Don't worry. So other findings are denial about limitations. Okay, he won't even accept what is their limitations. So these are the patients most responsible for falls. I mean, most susceptible to falls. Okay, because they can't judge what is happening to them. They will fall. They'll go to this side and that side. They'll fall. Not able to interpret non-verbal language or understand the hidden meanings of things. So their logical thinking is there. Yeah. So not able to interpret non-verbal language. Okay, normal conversation of a day, normal jokes and all that. They won't be able to guess that. Very short attention span. Okay. Yeah. So right brain injury was related to memory. So if there is no memory, short-term attention span hoga. Okay. Now of brain. What are the findings? Right side hemiplegia. उसका left side hemiplegia था. I think I have not written in that, but there was left-sided hemiplegia. In this, you will have right-sided affected. Okay. Aphasia will be there. Trouble formulating words. Did anyone say anything?
No, ma'am.
No. Okay. Aphasia will be there. Trouble formulating words and comprehending them. Aware of their limits. They will be aware of their limits. Why? Because logically thinking. Experience depression. They'll experience anger and frustration also. But main is depression. The other one will not be able to judge. They will be able to judge what is happening to them. And they will be very sad, depressed, and angry, frustrated all the time.
Ma'am, again, your screen is unmute.
Today.
Now you are.
Do you want me to change to previous screen?
No.
No.
You just mute right now.
Okay. So yeah. They'll be having issues with writing, they'll be having issues with solving problems, their logical thinking will be depleted, but their memory will be intact because left side is affected, right side is responsible for memory. Okay. Issues with seeing on the right side. Yeah, as there was for left side, their right side was depleted, and in left brain injury, their right side vision will be compromised. Okay. How can stroke be diagnosed? Before doing anything, if a stroke patient comes, first thing we'll do is
CT scan.
yes, not even neurological assessment. We'll just ask the symptoms. If the symptoms are be fast.
I think this one is the question we got in mock test.
Oh, okay. Okay, so the answer was CT scan?
Yes, ma'am.
Good. So yeah.
And my answer is wrong because I take the neuro assessment.
It's okay, but you got to know na that this is the answer. Now next time it will not be wrong. So what I'm saying is that you'll ask the symptoms first. The person who is
Ma'am, clinical evaluations करेंगे. Clinical
Yes.
evaluation.
Clinical evaluation करेंगे, but clinical evaluation, what is included in clinical evaluation? Like you have to do everything fast. You have to take the CT scan also. There is 1 hour of that golden era. Okay. So you have to do CT scan, and that also you have to determine which stroke this is. Is it a ischemic stroke or a hemorrhagic stroke? Because they both have different treatments, totally different treatments. An ischemic stroke can be resolved in 1 hour, but hemorrhagic stroke cannot be resolved in 1 hour. Okay. So history is important. First of all, just ask. Okay, generally the patient is fainted in the bathroom, and like he tries to call it. This is the history. Then he tries to call, he tries to pull up the bathroom, and he falls down. Generally, if you read the cases of stroke patients, now this is the majority history, that he tried to call and something, and then this one side of the face started drooping, and this is the history. So we just asked that what time did you see these symptoms happening to the kin who brought him. Okay, so timing is important. Then CT scan करेंगे. CT scan में what we'll see? We'll see if the stroke is ischemic, if there is a clot, or if there is a rupture. Okay, two things we'll see. If there is a
Ischemic or hemorrhage.
embolus, yes. If there is an embolus, but what will you see in the screen? CT scan, if you see, what will you see in ischemic stroke? An embolus. Okay, you'll see a clot sort of in some ventricle, a black thing. Okay. And in ischemic, you will see a very radiating black shadow. Sorry, in hemorrhagic.
Ma'am, we can say that when a patient having a ischemic stroke, so we can say that shortness of blood supply, that's why they're having a ischemic stroke.
Yes.
Oxygen or blood supply.
Yes. Yes, you're right. But the thing is, what will you see? Like you have to judge it in like minutes, that which stroke is the patient having. So when you see the CT screen, when you see the CT film, in embolus, in ischemic stroke, you'll see an embolus, a clot formation in one of the ventricles, a black dot or something like that. Okay. But in hemorrhagic, what you'll see a radiating sort of black shadow. Okay. So there is a rupture of membrane. There is blood everywhere, rupture of membrane. Okay. So there will be a sort of black shadow, something. Okay. It will not look normal.
But madam, I was see that when hemorrhagic stroke patient, we see it, their CT scan. In that time, they are showing like a cloudy sketch, like a hemorrhagic stroke.
That's what I've said now. There will be a black shadow, cloudy. Yes, cloudy is the right word. There will be a cloudy formation. It will not be just a clot. It will be like spreaded in the like nearby the vessels, nearby the ventricles. Okay.
Yes.
So next is MRI. MRI we'll do if we are not able to guess where the embolus is. So we'll do MRI to see where the rupture is. We'll get to know now where is the rupture. Okay. Cardiac assessment. Okay, this is afterwards. These all are afterwards. Once the patient is a little stable. First we'll do this, and we'll get to know, and then we'll start the treatment. Okay, but cardiac assessment, additional studies, ECG we'll do afterwards to get like to rule out where the embolus came from. Mainly if it's from endocarditis, you'll get to know. Okay, or if there was a arterial flutter or arterial fibrillation, you'll get to know. Chest X-ray will rule out any infection in the heart. Echocardiogram will rule out everything. Okay.
मैम एंजियोग्राफी भी करेंगे इसके साथ ही जब कार्डियक असेसमेंट करेंगे तो उसके साथ
Angiography is used. No. Angiography we'll do afterwards for the treatment. Okay. It's done for the treatment. That patient is already dying. Why would you go and you will do an invasive procedure on him right now? So it will be afterwards if the patient is stable. If there is hemorrhagic stroke, the main symptom is increased ICP. So you will decrease the ICP first, you will make the patient stable, you'll try to control his hypertension, then we'll proceed to angioplasty and all that. We'll discuss that later. Okay. Then additional blood counts, so we'll do complete blood counts, coagulation studies. Coagulation studies are very important. PT-INR is very important in both the cases. Okay. We have to see what is the clotting. Yeah. Then electrolytes, renal and hepatic studies, lipid profile, cerebrospinal fluid analysis is also done, but done rarely in strokes. Okay. Just to see if there is some, like if it is hemorrhagic stroke due to some head trauma or something, then we go for CSF analysis. Otherwise, it's not recommended. Okay. And rest of the studies, why do we do rest of the blood count? It is very important that when you administer TPA, tissue plasminogen activator, your rest of the blood count should be normal. Otherwise, you can't give it. Okay. So what is TPA? TPA is tissue plasminogen activator. It's used for, it's used in the first 1 hour for ischemic stroke, not for hemorrhagic stroke. Why is it used for ischemic stroke? Because it will dissolve the clot. It will dissolve the clot and the blood will be able to pass.
Clotting in ischemic stroke. That's why.
Yes, yes, yes. Okay. But if you'll give it in hemorrhagic stroke, what will happen? Or blast ho jayega.
Ruptured or leaking ho jayegi, ma'am.
Yes, there will be more increase in ICP. The patient can get into immediate death.
Yes.
Then next is, so it is given within 3 to 4.5 hours of the onset of signs and symptoms. So till the time the patient reaches the hospital, only 1 hour is left generally.
Hemorrhagic stroke, there is another solution. Most of doctors, they were doing, if bleed in a subdural or a extradural, and patient, doctors, most of surgeon trying to they passing a drain and they took out.
We will read that later. We'll read that in surgical procedures. Okay.
Yeah. Okay. Oh.
Ma'am, we can't hear you.
Why is this happening today? I am so sorry.
It's okay, ma'am.
Where were we? We were in this. Okay. So, last mein kaha thi? So TPA is given in the golden hour and it is given for ischemic stroke, and ischemic stroke is the only stroke you can prevent in that 1 hour. If there is hemorrhagic stroke, it's a long procedure. But if it is ischemic stroke and you have administered TPA in 1 hour of his admission, his signs and symptoms, then you can save the patient because it will dissolve the clot and the blood will start flowing through the brain. Okay. So,
ma'am, is this the prior treatment like TPA?
Yes. For ischemic stroke, after CT scan. First is CT scan. First we have to detect. First we have to detect which stroke is.
If we don't get that CT scan, and other option is TPA. If we don't get a CT scan in the exam, like in options.
If you don't get CT scan, patients are sent for MRI. If you don't have CT scan, MRI in your hospital, they are sent out in other hospitals for this thing. Then only you can do it. Otherwise, there is no use. You can't harm the patient now. There is a 50-50 chance. If there is hemorrhagic, then what will you do? Patient will die on the spot.
For ischemic stroke, I think so, ma'am.
Yes. So TPA is always given after confirming if it is ischemic stroke. Okay. It is given within 3 to 4.5 hours of the onset of signs and symptoms. CT scan is negative for bleed, then only you will give it. lab values within normal range, especially blood glucose and PT-INR. PT-INR because PT-INR, if it is less only, if the patient is on anticoagulants and you are giving TPA, then what will happen? That loss will
Hemorrhagic.
dissolve, but other, like, there will be more, yeah. So patient will be more at a risk of aneurysm afterwards if he's on anticoagulant and you are giving TPA. So we have to consider that also. Then BP control, yeah, BP should be controlled less than 185 by 110. So we give antihypertensives also side by side when the patient arrives. This is the initial treatment. TPA, antihypertensive, hasn't recently received heparin or any other anticoagulant. We generally see the patient history. If he was on heparin or any other coagulant, we can't give TPA because it will risk to aneurysm of the brain. Okay.
Yes.
Then surgical care. Once this is all done, ischemic stroke वहीं पे resolve हो गया. The other one is hemorrhagic stroke. Now hemorrhagic stroke is the one in which the ICP is increased. Okay, so for that, what you have to do, there will be
bleeding inside the vein.
no one fills up the gaps. Yeah, so first of all, ICP will be increased, but ICP will be increased because there will be a leak in CSF. There will be a leak. If there is subarachnoid hemorrhage, what will happen? That space in which the blood is filled, CSF flows in that space. Okay, so that CSF will start to leak in the brain or anywhere else in the brain or spinal cord. Okay, so what will happen? Increase ICP, hypertension, all other symptoms. Okay, ICP is only related to hemorrhagic stroke. That's why I'm repeating it again and again. Okay, so carotid endarterectomy. Someone was telling me drain. Someone was asking me about the drain.
Yeah.
Right?
Yeah, ma'am.
Yeah. So this is what it is called. You put a drain inside the part where there is aneurysm, and you try to collect the excessive amount of blood with CSF. Okay. Yes. To decrease the ICP. Along with mannitol and antihypertensives, they are going side by side. This is the main treatment. Okay. So we drain out the CSF in this. Next is transluminal angioplasty. Someone was referring to angioplasty also.
Yeah, madam.
It is a very, it is a very minimal invasive procedure. What we do is we just insert a needle through carotid generally, and we clear out the plaque. There is plaque on both sides, right? It's generally used for this thing, ischemic stroke. So there are the plaques, it is cleared by the angioplasty. Okay?
Yes, ma'am.
Got it? Got it? Yeah.
Yes,
So next is stunting. Stunting, what we do is, stunting we'll, it's also an invasive procedure. What you'll do is you'll put a balloon sort of thing inside the blood vessel to widen the blood vessel, and so that the blood can pass. Okay, that's all. There's not much difference between angioplasty and stunting. Stunting, there is a balloon and the blood will pass. The other one is angioplasty, in which we'll just clear out the plaque from the walls and the blood will pass. Then last one is extracranial intracranial bypass. Yeah, so this is a neuro procedure and this is a major procedure. If nothing else works, you can't, if you can't go through the stunting, the transluminal angioplasty, you have to, like, the vessel is somewhere deep in the brain, then you have to go through this procedure. In this, what you do is, you will take the clotted vessel and you will take another vessel outside the skull, another blood vessel from outside the skull, and you will join those two vessels. So there will be passage of blood flow. So it's a very technique procedure, and it needs a lot of skills. and it is the last option anyone can opt for. Okay. Is there any
Yes,
doubt?
ma'am.
Tell me. Is there any doubt?
No,
No,
ma'am.
ma'am.
Yeah, ma'am. Ma'am,
Voice audible?
question, when patient suffering from a hemorrhagic stroke, in that case, seizure is, I think, having a patient or
Yes,
not.
increased ICP is definitely related to seizures. Okay, so we will have seizure precautions for the patient. We will start the patients on anticonvulsants also.
Yes.
Very good, very right.
We are trying to clear
We do give levetiracetam to the patient in India.
sharp equipment, and that is also prevention of the patient.
Pardon, I couldn't hear you. Can you repeat it?
No, ma'am. When this kind of patient come to the ward, nurse try to
Yes.
clear side by side sharp things like this knife or this kind of thing, because patient has a seizure precaution or a bedside precaution.
Yeah, we'll discuss it afterwards. That you have to take seizure precautions. You have to have side rails, and you have to take fall precautions, swallowing precautions. Okay, you have to do regular sections. We'll discuss it afterwards. Do you all want a break or something, or shall I continue?
Yes, ma'am.
I think we need a stretch break for a 10 minutes.
Okay, sure. We'll discuss after 10 minutes. Okay, 7:30, 7:44. You can be back.
Okay.
Okay.
Thank you.
If someone has any doubts, they can just ask me. Okay.
Ma'am,
Yeah.
like in NCLEX and in neurological system, like what are the main main topics which always comes in NCLEX exam?
What are the main topics in neurological system?
Yes, ma'am.
Okay. First is stroke only, then meningitis for sure, and let me just go through that PPT one.
Parkinson's disease.
Parkinson's, yeah, dementia, Parkinson's, dementia bhi aata hai. Dementia is a must. Okay, and Parkinson, yeah.
And meningitis, myasthenia gravis.
Parkinson, you will not get questions from the disease. What you'll get is what how you'll take care of the patient. That is
nursing
more.
intervention.
Nursing intervention. So that will also be very tricky. So you have to solve the questions for that, no?
Yes, ma'am.
They make it very tricky. I don't know.
Yeah.
I mean, you'll see that all the options you will find correct only, and then you'll get to know that only 2 were right.
And when should a person take what?
Pardon?
I said that how much preparation need man for NCLEX? Like how months? How many months?
I couldn't get you.
And I'm trying to say that before how much time in like before giving NCLEX, how much time a person need to do practice on your work?
How much time do you need to study
Yeah,
for NCLEX before exam?
yeah, that's all.
It depends actually, but I think the best way to do it is that in the morning or whenever you are more fresh, you do the questions. And no, actually, whenever you are more fresh, you do the theory. And when you are a little tired, you do the MCQ questions, and you do it every day, around 50 to 60 of the
Yeah,
same topic.
because
In the morning, you do the theory, you just read the theory, and in the evening, you can do the questions.
Ma'am, can like today as well, like can we get more questions for like 50 more questions, like mock test?
50 more questions. I'll try to give you on stroke.
Like in on neurological system whole.
Okay, sure. I'll give you till tomorrow if it's okay.
Yes, ma'am.
Yeah, because I'll have to see and make it. Okay.
so from
I'll
my
give it.
condition is that
Mm-hmm.
I can only give this exam next year, but because I'm not eligible for it.
You are not eligible for exam.
Yeah, because I don't have a degree yet. Like I have only an internship is degree. So after that I can do it.
I still did not get your question. You can just type it for me if you don't mind.
Is my voice not clear? Wait, I'm wearing Bluetooth, maybe that's the
Okay, you can just
like
type
it.
the question for me if it's okay.
I think he said like his bachelor's is like not
Mm-hmm.
completed yet, so he
Okay.
is on his last year. So he's on his internship period or something.
So
So that's
he'll
why he's
like
not
when
eligible.
will it be completed? So you use that time to study, and then once your bachelor's is completed, you can just right away appear for NCLEX.
Can you hear me now?
No,
Yes.
ma'am. One of my friend, he live in USA. He told me that is not in मतलब ये कोई शर्त नहीं है कि जो अपना BSN के अलावा कोई इंक्लेक्स नहीं दे सकता. Everyone give their exam if they done diploma nursing or a 3-year diploma nursing or a
Yeah,
bachelor.
everyone can give the exam. There's
Yes,
nothing
ma'am.
like that.
Yes. JNM also gave.
There is no any condition.
Yeah, there is nothing. There's no condition as such that bachelors will only give the exam. GNMs can also give.
Yes, ma'am.
They ask you particularly, na, if your studies, if your graduation was of 3 years or 4 years, they'll ask you in the application.
Yeah,
So,
ma'am.
Yes,
yeah.
Payment also same, ma'am, for MSc or whatever.
Yes.
Payment is same for all. Examination fees is same for all.
I think
No,
it's $200, na ma'am.
It was around, I don't remember now. It's been a long time.
No,
But
ma'am.
yeah,
I'm not talking about the exam. I'm talking about the working time.
no. I am talking about the examination fees. $200
No.
someone was saying, na? So I don't remember it correctly, but yeah, it is somewhat around this only, 200 to 300, because you'll do your credential evaluation also. The whole process will take around 1 lakh. So you can save 1 lakh. Credential evaluation, and then you'll send your transcripts. Like it's a whole process.
And
Did you
ma'am,
get,
one
did
thing,
you get a
like
job?
I have completed my AFRA registration in I think on September 2024.
Okay. Ma'am, not break time. ये Uzma, it is a break time.
Yes, ma'am.
It's a break time.
Okay, ma'am.
It's a
Okay,
break
ma'am.
time. You can go. You can go till 4:45. Okay. We are just
Okay.
discussing NCLEX. Nothing more.
And ma'am, my husband, he is living in Australia. And
Okay.
on September 2024, I have completed my after registration. Like my portfolio is completed.
Everything is done now. So
Yes.
just the NCLEX examination piece you have to give.
Yes, and
Yeah.
preparation is most important.
No, you have you registered with the PSMU?
No, not yet.
Yeah, so that will take around 200, I guess. Yeah. 190 to 200,
And
maybe.
my question is like my after registration is completed, like my document verification is completed. So like if I want to give the how till validity of this portfolio, like 2 year,
It's
1
around
year.
1 year. It's 1 year. It's written in the profile itself. It will be
Okay,
1 year.
1 year.
After 1 year, it will be deactivated automatically.
Then I have to again
Yeah, you have to make another profile then. Why would it take so long? Just do it.
Ma'am,
uh,
is this she is talking about eligibility?
No, she's talking about that she has made a profile in Afra. Afra, if I'm not wrong, Bhavna,
Okay.
yeah.
Yeah.
है ना? So in that, she's saying that I made a profile a couple of months back, and how long is that profile will be active?
Okay.
So
Okay.
as far as I remember, it was around 1 year. For that also,
Mm.
for CGFNS also, it's 1 year. And Canada, I have not applied, so I don't know. Canada, I think it's direct evaluation, and then it's an easier process for Canada. If
I
there
think,
is
ma'am, we
anyone
have
from
to take
Canada, yeah.
eligibility. Then now they are asking for hours and all. They change so many rules. It's
Oh.
depend which state we are going to.
So which state is asking hours? Ontario?
Ontario and another one also. What is that? Nova Scotia.
Why do you want to
And
go
there is
there?
no, I don't want, ma'am. Actually, I'm for New York.
Okay.
Yes,
So your
ma'am.
clinical hours are not completed or what?
No. Mine, I'm already, ma'am, I'm as a RN working in Bahrain. 3 year I have
Okay.
in India and 4 year already in Bahrain.
Okay. That's good.
Yes, ma'am.
Ma'am,
Yeah,
can you
tell
tell
me.
me your good name? What is your name?
My name is Captain Suruchi Puni.
Sorry?
Captain Suruchi.
Captain
Captain
Surusi.
I have served in army, so I put a captain.
Okay,
I
you
get
are
that
an
privilege.
army person.
Yes,
I
ma'am.
used to be an army personnel, but now I'm a registered RN nurse in USA.
Okay, that's
And we
great.
are very proud that we are studied with him. From
Arey, aisa nahi. It's nothing like that. You all will be joining me in some time. It depends where you are going.
Ma'am,
Actually, the process in every state and every country has its own time.
and what is
ma'am,
the
are you from India or you are still in India?
No, I am right now I'm traveling. So it's been around 6 months I've not been in India. So,
Okay.
but yeah, I'm planning to go there before starting to work again. I
Okay.
completed my because I did not get my New York license. It took
Oh,
around 8 months after giving an exam.
okay. Oh, yeah,
So
they are taking long
yeah,
time for the license actually.
I don't know. It usually doesn't take that much time for New York, but there was some. I mean, the Trump administration came and everything was delayed. So
ma'am OSCE as well in USA?
in USA there is no OSCE, but every state has its own regulations. Some want you to give CGFNS examinations along with NCLEX. Some want you to just give CGFNS exam, and others generally require NCLEX, but no OSCE.
Okay, NCLEX and after that interview.
Yeah, a few states do require other certifications, like New York required infection control and child abuse mandatory act. So I
Child
had to do those
abuse
two
and
courses also. Yeah, and infection control.
yes, ma'am.
So every state has its bits and bytes, but I was told that New York will be faster, but it took a long time. So I started working as a travel nurse.
Even
Ma'am,
for
what is
ATT also, ma'am, it's taking too much time.
ATT
For the ATT,
for
New
Australia?
York.
New
No,
York,
no, for the
yeah.
New York, ma'am.
Yeah.
They are also
Yeah.
taking too much time for the ATT.
I think Canada is a better option if you just put your application in the express entry. After PR, you'll be eligible, maybe. No?
and ma'am,
Yes, ma'am.
what is the IELTS score in USA?
In USA, it's very less. It's around 6.5. In Australia, it's around 7 or 7.5, if I'm not
Is
wrong.
7 in each module, ma'am.
Yeah, 7 in each
And I
module.
always got stuck in 6 in reading.
In USA, you have to get 7 in a
Speaking.
few, yeah, speaking. Just the speaking?
Yes, I think so.
Actually, my score was quite good, so I don't know. So shall we start the class now? It's 47.
Yes, ma'am.
Yeah?
Yes, carry.
Okay. So where were we?
We have completed surgical care.
Yeah. So is there any doubt?
No, ma'am.
No doubts with the surgical procedures? What
Ma'am,
the name suggests itself. All the names are very self-explanatory. So you can just see the names and you can guess what it is. Okay. Angioplasty is in minor invasive, clearing the plaque. Stunting is stunt, balloon. Carotid endotectomy is draining. Where there is ectomy, something is going out. So there is drain of CSF. And extracranial, intracranial bypasses, there is a bypass. So two vessels are getting attached. Okay, one from outer skull and one which is affected by the clot. Okay. So next is, yeah, nursing care for TPA. Here we have read this, I guess. Check for bleeding. Okay. Neuro checks around the clock. Neurological assessment. So you have to check the symptoms of stroke. Be fast. Check them. वो be fast wala mnemonic, if you remember. Do you remember now? What was the mnemonic based on? Be fast. All the symptoms. What symptoms are there for stroke? Ataxia. Body का क्या क्या है? Ataxia. है ना? Yeah. Okay. Then next is blood pressure medication if needed for hypertension. We have to keep the blood pressure in control, because in case of ICP, if it is not in control, ICP will be increased and patient can have seizures. Vital sign monitoring, very important. You have to see the blood pressure, you have to see the heart rate, you have to see the respiratory rate and temperature. Temperature for infection, heart rate for seeing the pounding pulse, or if there is any leak in the, if there is any cerebral hematoma or something. Okay. Then next is lab values. Lab values, I told you that lab values have to be normal in order to administer TPA. Then preventing injury, as there is a risk for scissors, you have to use side rails, you have to use what else we use? Yeah, suctioning, and you have to see that there is no injury to the patient. Okay, any fall injury also, because patient will be unaware of one side of the like one side hemiplegia, and they can just turn and they can fall down. Avoid unnecessary veiny punches. This is self-explanatory. Why would you not puncture the patient? Because patient will be on TPA, so patient will be having excessive blood loss if there is a veiny puncture. है ना?
Yes, ma'am.
So you will not unnecessarily puncture the patient. Avoid IM injections. Post patients go to ICU for monitoring. Most patients are found in ICU only. So avoid IM injections. That's why our LMWH is subcutaneous. What is LMWH?
Low molecular
Yeah. What is it used for? For?
heparin ischemic stroke.
As a and
Yeah, it is used afterwards, after the golden hour has been done, and it patient is put on LMWH 40 or 20 accordingly, after seeing what is the size of the clot now, or does it need more resolving or something. Okay, so we put the patient on LMWH afterwards. Next is nursing responsibilities. So maybe we have to monitor the temperature, BP, heart rate, respiratory rate. Airway, yeah, we have to see the airway of the patient. If the patient is having issue in swallowing, suction should be kept bedside, and every 2 hours suctioning should be done, or whenever required. Then cranial nerve assessment should be there. Cranial nerves, all 12 cranial nerves we read yesterday, if you remember. So
ma'am.
we have to see the pupils of the patient, the swallowing, the gag reflex, the facial gaze, and coordination. So we can't see because the patient will be bedridden. So bladder की spelling गलत है. Bladder and bowel function. Bladder and bowel function, as patient will be having some numbness over there also, or complete hemiplegia or quadriplegia. They can't tell you if they want to urine or not. So you have to put a Foley's and a bedpan if they have some stimulus. But if it is totally numb, then you have to check it yourself, give 2 hours positioning to maintain skin integrity and limb integrity, ROM exercises, physiotherapy, everything is done. You do remember, na, in ICU, we always give 2 hour care. In every 2 hours, we try to change the position of the patient, and we do ROM exercises on them. Yeah, to prevent bed sores. We
Yes,
put air mattresses. So all of that has to be done. It's very important. And head elevation for, because ICP is increased.
decrease
So
ICP.
yeah, so to decrease the ICP, and also so that the patient won't aspirate. Okay. Then diet, patient is generally kept on NG tube, but if they are able to swallow, you have to attend the patient till the time the patient has finished their food. Otherwise, patients are normally on NG tube only. So you have to get soft or liquid diet, or crushed medication should be given crushed. Then speech therapy, once the patient is getting a little better, they are started on speech therapy. They are like, their speech is slurred now with time, so they are practiced for that, so that their speech gets better. Then communication, aphasia. So they suffer from aphasia, and then when they are a little better, they, like, you have to treat them accordingly. So aphasia is of two types. Basically, one is receptive, one is expressive. In receptive, the patient is unable to comprehend. So you only have to observe. You have to be a very keen observant, and you have to see what he wants. You have to ask the patient repeatedly, because he won't be able to comprehend. Okay, so you ask the same simple question repeatedly till the time he understands and answers. Okay, so use short phrases, simple details. Do you want water? Water. Do you want water? Water. ऐसे करके. Then use gestures. Point towards the water. Water. If he can't like comprehend your speech, he will be able to see what you're trying to tell him. Okay. Then be patient. You have to be very patient with these patients, because it takes a lot of time for them to recover and to comprehend. Then remove distractions and repeat. Actually, they can also get agitated, and they can also throw things. So you have to remove unnecessary things, and you just have to ask simple questions in a very polite way and just repeat it so that they understand. Expressive, inexpressive, they can comprehend what you are saying, but they will have trouble responding you. Okay. So in this also, you have to be patient, ask one question at a time.
Ma'am, again your screen is mute.
Where did it get mute? How much did you listen?
Now it's okay, ma'am.
Okay. Okay, so communication board is the patient is able to comprehend. So you can give him the communication board and he will just write why or something like that. Or he'll just tell you by writing a little bit. Okay, so be direct and ask questions with simple responses. Water, yes. Yes or no questions or one word questions. Don't ask descriptive questions. Okay, I think it's done. Yeah. So next is hydrocephalus, right? So before hydrocephalus, I just want to ask you that you people have gone through your mock test, so you must have come across questions related to lumbar puncture. So did you come across any question related to lumbar puncture?
Yes, ma'am.
So what was the question
Yes,
about?
they were
So
asking for like positions, this stuff like that.
because that is the main question they will ask. There is nothing more to tell about in lumbar puncture actually. But
No, I think the main topics we have already covered.
yeah, lumbar puncture is just like a diagnostic evaluation for rest of the neurological disorders. So for that, basically, you have to be aware of the position, even if it's lying position, left lateral position, any lateral position, or sitting position with your chest towards the cardiac table. There are only two positions used. Then CSF is withdrawn from the subarachnoid mater. You can just write these points actually. Yeah. So CSF is withdrawn from the subarachnoid mater. I told you, no, the CSF flows in these gaps between the meninges. So from there they withdraw it.
CSF gap.
And it's a sterile procedure. What else?
Yes, ma'am. The previous lecturer told us all this. We have already written it.
Okay, that's good. So hydrocephalus is what? You have
It is
like
a
has
part
anyone
of
seen it?
meningitis. It is kind of meningitis.
Has anyone
No,
seen it
sorry.
in has anyone seen it in the hospital?
No, ma'am.
Yes, ma'am. Their head is so bigger than the body.
It's more common in children actually, in infants, newborns.
And I saw it once during my years.
Yeah, you must have seen it in infants or with patients
Yeah, ma'am.
or
His
in
head was
patients
too
with
big.
head trauma. Yeah, yeah. So what is this? What is hydrocephalus? It is the buildup of CSF in the brain. It's as simple as that. Okay, so the overproduction can be caused due to congenital disorders, or it can be caused due to head trauma. There are only two ways. Okay, so these two are the only ways through which CSF production can overaccumulate in the brain and impaired drainage is there. Okay, so accumulation of CSF will lead to wherever there is accumulation in whichever ventricle there is accumulation, the ventricle will get inflamed, dilated. Okay, so when it will be dilated, the head circumference will increase. The other tissues of the brain, the other parts of the brain, the other ventricles of the brain will be depressed, compressed, right? One ventricle is getting huge, other are getting depressed. So the brain function will be depleted and ICP will be increased. As simple as that. what will happen? Accumulation of CSF due to head injury or congenital anomaly. Dilated ventricle. Ventricle is dilated. Ventricle is inflamed because of increased amount of CSF in that ventricle. This part will get bigger and bigger, and other parts of the brain will get depleted or compressed. Okay, so this will this will cause an increase in the intracranial pressure. Okay, then can progress to brain damage or death. Yeah, if it is left untreated, then it can progress to damage, brain damage or death of the patient. Then what are the clinical features? Rapidly enlarging head circumference. We'll start with the infants first. So in infants, what is the normal head circumference? In newborns, is there anyone who has
33
worked in
centimeter.
neonatology? Yeah, it's
33
somewhere, yeah, 33 to 36. And head circumference is the largest circumference in a neonate. After that comes the chest circumference, which is 2 centimeters less than the head circumference, around 2 centimeters. So newborn head circumference is 2 centimeters larger than the chest circumference. These normal findings you should know, because when a baby is born, sometimes there is just normal molding of the patient because of the birth of the patient, because of the birth of the baby. Okay, birth is a little pressurized, so there can be a little molding on the head. So you can't, like, it can be confused with subdural hemorrhage, I mean hydrocephalus or subdural hemorrhage, but you have to see. After some time that will get dissolved, and hydrocephalus will get only larger with time. Okay. Then bulging anterior fontanelle. There are 2 fontanelles in neonates. One is anterior and one is posterior. So which one is the larger one?
Anterior.
Anterior. So the anterior fontanelle closes in around 2 years of the birth of the baby, like 18 months to 2 years. That is the estimated time. And the posterior fontanelle is generally closed after birth or after a few weeks of birth. Yeah, after a few weeks of birth, 1.5 months. Someone is having a baby, so they know better. So these are the normal findings. So what we have to discuss here is anterior fontanelle. That is important because when there is an increase in the ICP, a very characteristic sign is shown in the anterior fontanelle, which is it will get bulged. It will get all swollen and bulged, and you can see the veins of the baby. Okay, so it is a very definitive sign of increased ICP. You can't confuse it with molding or subdural hemorrhage. Okay. So white space suture lines. Yeah. So once the ICP starts increasing, suture lines are the lines which connect the anterior fontanelle to the exterior fontanelle. Anterior fontanelle to the posterior fontanelle. Okay. There is anterior fontanelle, then there are suture lines, and then there is posterior fontanelle. So the suture line will, baby's head is very soft and the skull is not properly formed. So the suture line will start to widen up. Okay. So it will look somewhat like this. It will look somewhat like this. Okay. Wild and bulging fontanelle, increased head circumference. Head circumference will start, like it will continuously increase. Prominent scalp veins. You will be able to see the veins of the baby on the head. Sunset eyes. The eyes will be like this. Okay.
Yes.
Down.
Yeah, facing downwards. Continuous downward gaze. Yeah, there will be a continuous downward gaze like this. Baby will continuously see downwards. Okay. These are called sunset eyes. And it's a late sign. After it is, like, when it is very much bulged out, then only you can see it, and it comes very late. Then these are the early signs that high-pitched cry, shrill cry will be there, poor feeding efforts, like he will not take feeds or there will be vomiting. And ICP ka to there is a definitive vomiting, which is known as projectile vomiting. There will be projectile vomiting, developmental delays, developmental delays, it's about later stages. But yeah, poor feeding, high pitch, chill cry, and continuously increasing head circumference will be there. So you have to check the head circumference every hour. Seen? Now in older children and adults, what are the signs? The normal signs of ICP, which you have read. So the signs which you have read in meningitis, it's almost the same as that only. So
Yes,
there will be
ma'am.
headache, severe headache, projectile vomiting, drowsiness, irritation, vision problems,
Yes.
yeah. So ataxia, unbalanced gait, hypertension, bradycardia, hypoventilation. Hypoventilation is a characteristic sign of neurological disorder and COPD.
मैम इसमें पेशेंट की वो भी हो सकती है, मेमोरी लॉस भी हो सकती है.
या पेशेंट का मेमोरी लॉस नहीं, मतलब बच्चों का तो infants don't have any memory, so they won't be having any memory loss, and in adults and in children there will be no memory loss. I mean they must be having some
कंफ्यूजन हो सकती है इनको,
yeah
इन्फेंट्स को.
confusion absolutely. In infants, no. In infants, that will be the last thing you will see because they won't be able to comprehend, right? But in older children, yes, there can be confusion. Whatever are the characteristics of meningitis, you can put it in this.
Yes.
Okay. So diagnosis in infants, you can't do CT scan because the skull is not, the fontanelle is open, right?
Ma'am,
And
yes.
anterior fontanelle closes in 2 years or 18 months. Okay.
18.
So till then you can just do USG of the brain and you can get it right with that only. And MRI and CT scan are used for older children and adults. Okay.
Yes. And ma'am, early sign is headache, drowsy.
Headache, drowsiness, yeah. Early signs that, and also the head circumference also. In adults also, head circumference is a major sign. I mean, it will increase if the ICP is increasing. And there is an accumulation of this thing, a CSF in the skull. There will be some sort of swelling or something. You will get to know then. And there will be severe headache. Projectile vomiting is a definitive sign. Anything related to brain, projectile vomiting is there. So that is a definitive sign. Then vision problem, blurred vision. It was there in meningitis also, if I remember. Yeah, there was blurred vision. There was this disturbance from light. So they prefer staying in dim lights, right? And confusion, as someone said.
Mental status change.
Yeah, the signs and symptoms are almost the same as of increased
There are
ICP in
early signs.
yeah. They're all the same. It's just you have to remember that in children you don't do MRI and CT scan till 2 years of age and till the fontanelle is open. Once the fontanelle is closed, anterior fontanelle is closed, then only you do it. Okay? Otherwise, it can affect their mental status afterwards. Anyhow, they'll be getting delayed developmental delays. And upar se, if you do CT scan also, it's harmful for the babies. Okay. Then in management is also the same. Seizure precautions have to be taken because increase in ICP. Right? So these are the pre-operative. Surgery has to be done. Surgery is the option, but before that, if it is an infant, we'll wait for some few months. We'll make the infant or the older children or adults, anyone, stable first. We'll decrease their hypertension, we'll decrease their ICP, we'll make them ready for the surgery first, and then we'll opt for surgery. So it's not like once you have diagnosed the other day, you can have an emergency surgery. No, It's not that kind of procedure. I mean, that kind of disease. Okay. So preoperative may you have to take seizure precautions. The patient will be on anticonvulsants. The patient will be on antihypertensive if he is an adult. Patient will be on mannitol and ICP decrease के लिए, yeah, these all are the definitive measures. Then daily measurement of the head circumference has to be there. Intake output chart has to be maintained because the patient will be having poor feeding in children, and vomiting and nausea in adults. So the nutrition will be compromised. So you have to maintain a intake output chart. Okay, then reposition the head frequently. Reposition the head frequently by also, if I can just remember, I did not tell you in positioning of stroke patients, if the patient has underwent a surgery or he has underwent any sort of procedure on one side, that side in positioning should remain upwards. Okay, you should not position you should position the patient as such that side is on the upper of the bed. That side should be okay. Am I making sense?
Yes, ma'am.
Okay. I forgot to tell it, I think. Now reposition the head frequently. If maybe you have to reposition the head frequently because patient, there is increased ICP. One side you'll
Yes.
even if you start doing it in the one side, there will be lack of oxygen in that side. Ischemia will be there. Brain ischemia can occur, na? Or aneurysm can occur. Anything can happen in increased ICP.
So, ma'am, what position? Sitting.
Sitting position, Fowler's position, semi-Fowler's position, and also if they want to do lateral positions, you just make sure that they are repositioning themselves quite frequently. That's all.
Okay.
Okay. And then in surgeries, what are the surgeries? Temporary external ventricular drainage device. It's sort of drain. A drain is put into your brain and it drains excess CSF into a drainage bag. So it's a minimal invasive procedure. You just have to insert the drain inside that dilated ventricle and all the CSF will drain out. Okay. Next is ventriculoperitoneal VP shunt. This is the major procedure. Drains excess CSF into the peritoneum where it is reabsorbed into the bloodstream. So all of the drain and everything is inserted in the body. I'll show you how it's inserted. Yeah. So the drain is inserted in the body from the dilated ventricle. It goes to the peritoneum. So the CSF is flow comes to the peritoneum, and from here it gets reabsorbed into the bloodstream. As you can, you have also have you seen dialysis?
Yes, ma'am.
In that also, the same thing happens, no? That all the excretory waste, it all goes into the peritoneum, and from there it is
enough.
Yeah. So peritoneum may jaake it will get reabsorbed. The CSF will get reabsorbed. So this is a permanent solution to this. Okay. Now nursing interventions, post-operative VP shunt. So once that procedure is done, position flat immediately following the procedure. You have to position flat, supine, later on unoperated side. Okay. First, immediately when you receive the patient, you have to make sure the patient is in the supine position and there is no head elevation, nothing. But later on, you can the ventricle will be inserted from one of the sides, even it's either it's right or it's left, right? So whichever side is operated, that side should be kept upwards. Okay, same thing is here only. Yeah. Later on, unoperated side should be downwards. Unoperated side should be downwards and operated side should be upwards. Actually, when we receive the patient, we never give the patient lateral positions. We like maybe we can give semi-lateral position by just keeping a pillow and just changing the position that way, because it can, like it is written over here, but it can hinder the drain if you keep it upwards. Okay, so we just try to keep keep the head straight or somewhat like this. Matlab this side se bhi, the drain is entering. We'll just keep that side a bit tilted, and that's how we keep the patient in the ward. But it is written here that later on unoperated side is kept on the bed. So this is NCLEX. So you have to study this one. Okay.
Yes.
Then prevent CSF over drainage. Okay, what it will do, it will prevent CSF over drainage. So maybe we do wrong. It will prevent CSF over drainage. Then ventricular collapse is prevented and sudden drop in ICP is not there. So yeah, that's their rationale. Okay. Then monitor for shunt malfunction. Yeah, shunts can get malfunctioned, and if they do, you will see the same effects like increase in ICP, increase in head circumference. So you have to check it like every 2 hourly. Then measure head circumference, check for signs of increased ICP. Okay. Monitor, what is it? Monitor?
Monitor for infection.
Yeah, monitor for infection. Oops. Yeah, monitor for infection. So for infection, what will happen? Tachycardia will happen all of a sudden. Normally, he'll be having a bradycardia, and achanak se he'll have a tachycardia, and also fever, temperature will rise. So you can just make out from that there's some infection has happened in the body. Then check for abdominal tenderness. Once you have done BP shunt, there may be some tenderness or pain in the abdominal region if there is any abnormality, or if there is excessive CSF in the stomach, it can get painful. So you have to check for abdominal tenderness, and also you have to check for abdominal distension. So you have to check if the stomach is distended more or less. You have to check that also 2 hourly. So head circumference, and if there is CP shunt, you have to check the abdominal also, abdominal circumference. Okay. Then test surgical site drainage for glucose. Why for glucose? This is very interesting. Why would you find glucose in a surgical site drainage? In meningitis, have you heard that in CSF analysis you found glucose and it means something?
And if we found a glucose in a CSF test, when we are checking the CSF, in that case, we have to treat the glucose also. So that's why.
No.
No, I think maybe there would be a leakage of
Test surgical
leakage of
site
blood.
drainage for glucose.
Ma'am, we can put a CSF fluid on a gauze. Then there will be a ring size form will be there in a
Halo
CSF.
formation. Halo
Yes, ma'am.
formation.
So
Yeah.
that
But
in that
once
case,
you check that halo formation and you have seen that halo formation contains of, so that simply means there
contains
is
CSF
glucose
fluid.
in the CSF.
Yes, ma'am.
So what does that mean? That means there is some sort of vegetation. There is some sort of infection in the surgical site.
Surgical site.
Sorry. Yeah. So you have to start antibiotics. First of all, surgical site should not have glucose because presence of glucose indicates the presence of bacteria. Okay. So for that, you
Ma'am, I
have to
have a
start.
question, ma'am.
Tell me.
Because we didn't learn that when like in lumbar puncture we have to check the glucose at the surgical, I mean the incision site or the halo sign.
No,
We
no,
just
no. In
learn
lumbar
about
puncture,
the
you
halo sign.
don't have to. In lumbar puncture, you don't have to do it. I'm
Okay.
just telling you
Because
that there
lumbar
is a
puncture
drain
is
entering.
different.
There is a drain entering from your brain. There is a surgical site, right? So in that
Okay.
surgical site, you are able to see some sort of leakage, right?
Yes, ma'am.
And when you check that leakage, you get to know that there is glucose in that leakage. So that is a sign of bacteria in that surgical site, which
Oh,
has grown due to leak in the CSF. So
yes.
there is some misplacement which has caused leakage of CSF outwards, which has formed a halo formation, a ring size formation, ring shape formation in the surgical dressing. Okay.
Yes, ma'am.
So these two are the basic signs that CSF has leaked and there is definitely infection and the patient will be given immediate antibiotics. Okay. Clear ho gaya?
Yes, ma'am.
So what are the nursing interventions? Even after the surgery is done, you saw what is the surgery. It is VP shunt. So there will be a drain inside the body of the kid or an adult, right? So it usually happens in kid actually. So there will be more surgeries for taking it out once it is removed or like what is the status, right? So you have to counsel the patient's skin accordingly and the patient itself that uh, there will be more surgeries. It will require revision surgeries. Okay. So patient should like at the time of discharge, you do counsel the patient, right? You do discharge teaching, you give discharge teaching. This is that. So and this comes in NCLEX. Okay. So shunt will require revision surgeries. Child should be active, but not too active. Okay. So he can do swimming, but he should not play very contact sports like boxing or karate. Okay. And also running should be prohibited because if he falls down on his head, it is gone. Okay. So next is enroll in early childhood developmental programs. As we discussed earlier, if an infant gets hydrocephalus, there can be developmental delays in their coming years. So for that, you have to enroll your child in early childhood developmental programs. Then monitor for shunt malfunction. This we have to teach the skin of the patient that uh, how will it look. The head circumference will start to increase, or if there is a peritoneal this shunt, then abdominal distension can be there, abdominal tenderness can be there. So anything like that happens, you have to bring the patient back to hospital. Okay. Signs of increased ICP we have to tell. If there is vomiting, projectile vomiting, persistent irritability, in infants there will be high pitched cry. Okay, so anything like that occurs, the patient should be brought back to the hospital. Next is monitor for infection that we have discussed. Fever, poor feeding, irritability. That's all. So, do you people have any doubts? No doubt.
What did you say in last? Oh, doubts.
Yeah.
It was same
Do
like
you
in
have
that
any
is.
doubts?
No, ma'am, it was almost same like in that is.
Ma'am, I have a doubt like regarding the test, like regarding the surgical side train for glucose. So how often we have to check?
How often? In the hospital? In the hospital, we can check every hourly. Like when the patient has immediately arrived, that's the best time to check. Like that's the main time to check for at least 24 hours. You have to check every hourly. And after that, you have to check every hour or 2 hours. Till the time patient is in hospital, the dressing is your responsibility. So, you should not you should not be called irresponsible. So I would prefer that I would check the patient's surgical site every 1 hour, especially in increased ICP cases, because you don't know if there is any malfunction or anything happening. If there is any shunt malfunction, you'll get to know in first 5 days only, right? She's so sad that we have to check every hour. Okay, anything else?
I have one more question that the mock test that you sent us are from you or
Farhad, I don't know why, but your voice is not clear to me. It's very hazy.
no, I think it is my microphone problem maybe. I will change it.
You can just type your answer, or anyone else can tell me what he's saying.
He's asking what you send the mock test is from the U world.
Yeah, it is from the U world.
Ma'am, it's the
You
same,
could
right?
relate it.
What we
Yeah, you
discussed
could relate the
yesterday.
questions.
Okay, ma'am,
Are all the
but
all of the questions are
but-
same? Do you mean that?
no, not same. I was saying
Then
that yesterday when we were doing the questions, there were 85 questions total.
yes.
But you only sent 50.
But then I realized
That-
now that you have not done a lot of topics. Stroke was not done, and stroke is the main topic from which questions come. So I eliminated the stroke questions from that mock test also.
Yes, ma'am, but that mock test was the rationals are very helpful. Like I was learning more
Okay,
from rationals than the actual class.
that is good to know. But yeah, I will provide you with more questions also. Okay. So
Yeah.
this time I'll just provide you the questions and we can discuss their answers in the next class. Okay. And you can just tell me what do you want to learn tomorrow. Do you want to start with gynae or do you want to start with cardiovascular?
Cardio, ma'am.
Cardio, ma'am,
Cardio?
because cardio
Audio, ma'am.
lengthy topic.
Yeah, cardio is lengthy, I know. So you can also do cardio or you can also opt for fundamental topic because the questions will be formed in a way that like it's more of nursing responsibilities. So even
Ma'am,
if
you
we do
should decide.
cardiovascular, yeah, even if we do cardiovascular, the thing is when I'll give you the questions, it will be more of like fundamentals of nursing. So, do you understand my
And
point?
ma'am, I think in NCLEX, weightage of fundamental questions are more now.
It's nothing like that, but the questions are formed like in that way.
Hmm.
Questions are formed in that way, but every topic has similar weightage. And when you'll do the exam, when you'll get the exam, you'll notice that only 2 or 3 topics are coming. They will not give you questions from all the topics. They'll just choose any 2 or 3 topics, and they'll give you questions accordingly.
Okay.
There must be someone who has done NCLEX before.
Ma'am.
Yes, but ma'am, we have to study everything. We don't know what they will ask.
Okay. So if you have done NCLEX before, you must have like noticed that they just give you questions from 2 or 3 main topics. Like I remember they gave me questions from psychiatry and midwifery mainly, and then other things were just optional. But these 2 were the main topics. So they were giving me repeatedly questions from these 2 fields. So
Like most of the question from psychiatry and gynae.
like it depends on your luck. What if you are very good in pharmacology and med surg, and these 2 topics come? Your exam is golden. But what if you are bad at these 2 topics and these 2 topics come?
Yes,
And ma'am,
ma'am.
is the
I'm
exam is
very
like if we get first we get the easier question, and if we get right the easier one, then the level of exam is difficult.
no, it's not
Yes.
like that.
No,
Ma'am,
it is.
I
It is.
want to
What
say
he's
something
saying is,
like
yes. Tell me.
what I want to say is like I took 2 times, so now
Mhm.
I studied like first time when I went, I have no knowledge. I just want to
Okay.
check how the exam because what all my friends of YouTube videos, others are saying, I'm not able to understand. I just went to try. So the next time when I went, I was very weak in ECG, the cardiac
Okay.
thing. You know, I got at least 10 questions on ECG. You want to
Yes,
know, like,
because the questions are formed that way. They will get to know that you like if you are
I'm
doing
weak in
1 or 2
ECG.
wrong in ECG, They will try to give you more in that.
Or in ECG. The same thing. One of my
That's what they
friends,
do.
he was very weak in pharmacy. All his whole 75 questions or 85 questions, all on pharmacy. No matter what, like
Yeah, this
so
happens.
like don't depend. I as my experience, I tell you that don't depend that like one topic you get or two topics. No, you just study. Like if you're
Yeah, you have to
studying,
do all the topics. You have to do all the topics. It's your luck if your favorite topic comes, and you are able to give 4-5 correct answers. Actually, they are very clever. When you give 4-5 correct answers, they'll change the topic.
yeah,
I
You know?
think it is AI
Yeah, this
based.
happens. Yeah, so this also happens. So it's very unpredictable. But the question format is the one we are giving you. So just try on practicing that. And in my experiences,
No, I think
बताइए.
I was saying that I think that luck is very important in this exam.
that's true. I
Yes,
agree.
yes, of course. You have to pray before going. Literally, you have to pray before going.
Madam, what's my question is negative mark is there?
No, there's no negative marking. You will not
Okay.
need negative marking. Once they figure out that you don't know that topic, they'll give you certain questions of that topic, and then it will automatically
No,
be negative.
like in SATA questions, if the answers are 4 correct and we did like we picked 5 and they
Okay.
cut 1 mark, like you're the scoring out of 4, you get like only 3 marks or 3 points. I mean, like you
Okay.
get partial
So
points.
yes, you're right. If a question has 4 right answers and two answers, like total 5 answers, and 3 are correct options. But what I have done is I've done 2 correct and 1 incorrect. So what will happen is I will get only 1 mark, because for incorrect marking and for correct marking, it will get stabilized, like it will get crossed over, and only 1 marks will be given to me. That is how it is done. If you have 2 correct and nothing wrong is there and total 3 were correct, then you'll get 2 marks. Got it? But that is not the point, actually. You should not worry about that. You should just worry about completing your course, and you should be prepared, whatever is going to come. Okay? So you have to train yourself for questions, and theory is not that important. I'm telling you again and again, because our brain is limited in that pressurized environment where we sit for 5 hours. It's very normal to forget things when it is needed the most. So you will forget theory, but you will never forget the type of questions you've done. Okay? Pardon? Is there any other
Tomorrow
question?
we are going to study fundamentals.
So just tell me the topics for tomorrow. I'll be starting with cardiovascular tomorrow. Okay? Is it okay with everyone?
Yeah,
Yes, ma'am.
okay, madam.
Okay. And do you have any feedback for me? Anything that I should improve on?
Good.
Nothing.
Anything that you are not able to like understand from my part?
It's not like that, ma'am. You are doing very good job. For my thing is like comparing with the previous madam and you, she always says that this is very important. Like she says that when we write, we take the notes. She says this is important. Put 2-3 stars. But from you, I'm not getting that.
Okay, but do you think that my PPT is limited than hers?
No, ma'am, it's not like that. But the
No.
thing is,
I'm telling you that. Do you think my content is less than what she used to teach?
No, it's
no,
not
it's
about
not
the
like that.
content, ma'am.
No.
It's not about the content.
Because okay, tell me.
Like for example, like I just want to, because like we studied meningitis, okay, for example, meningitis. So she told 2 stars to put droplet infection and surgical mask and projectile vomiting.
Okay. Okay.
And others she gave all the other stuff to like all the material, but she says that okay, this is important. There are 2 signs, Kerning sign and
like
Burdick
what are the
sign. That's so
most important things and what are the not, like that kind of.
Oh, so in this topic, what do you want to know, which is not important? I think I've just given you the important slides. Whichever, every side is important for me. Every side is important for me.
Because we have
formed
done
the
the
PPT
mock
like that.
test.
Yeah.
So there was like the easiest one, we got the questions, right? Nothing is like more important or less important.
Exactly. That's what I'm saying, that there is nothing more or less important. You'll get the easiest question. So I can't predict that. But I can predict one thing, that whatever is given in the slide, you have to give it a note. You have to read it. You have to by heart it. From the diagram of that heart and the functions of all the lobes to the nursing intervention, everything is important. Because I've
we
given
just
it in a
wanted
very
from
limited
you,
form.
like we just love
can
your what you teach us, but we just want like please provide us the mock test questions, because
Yeah, I'll give it to you. I'll give it to you at like, just give me 2 hours. I'll give it to you.
And one more thing, ma'am, please provide us the PPT for this hydrocephalus and stroke.
Yes.
So day-to-day
I'll
class PPT, we are happy to share the PPT. Day-to-day class PPT.
So I'll give it to Sumit and he'll forward it to you if it's okay. Okay?
Yeah, better to refer the in future also.
Better to refer what?
Future.
In future exam preparation.
In future, okay.
Reference purpose.
Yeah. Just take it. It's for you only. Take it. Okay. So
Thank you.
we'll wind up the class.
Yes, ma'am.
Yes, ma'am. Thank you.
Thank you.
Any other queries, you can I'll ask Sumit to add me to the group. What else? Okay, or we can discuss it tomorrow. Okay.
Okay,
Thank you.
And also, I want everyone to do the first mock test till tomorrow, because we'll be discussing it if there is any queries. And I will be providing you the second one in next 2 hours.
Yes, ma'am. I have already done that first one.
Sure. Thank you.
Okay.
Thank you.
Okay. Bye.
Bye, ma'am. Thank you.
Ma'am, thank you.
Bye.